This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Hey, Impact Healthcare crowd. I am super excited to talk about this because myself, I am a data nerd. Like, I love looking at the data. And this is a conversation all around that with our guest, John Quinn, who is the CEO of a company called Wellnecity. And John, I would love for you to give our Impact Healthcare crowd a understanding of who you are, because you have a very unique background in regards to how you approach this healthcare space. And tell us a little bit about your great organization.
Wellnecity is a 4-year-old company. We basically focus on self-funded employers, small and mid-sized employers. Our sweet spot is between 1,000 employees and 5,000 employees. And the mission or value prop that we've gone out to the market to solve is really improving the information that employers have direct hands on to improve their decision-making around vendors and the health plan benefits that they're offering to their people.
Awesome. And John, you are not an insurance broker. You're not a doc. You come at this from a completely different angle. Talk to me about your past.
Yeah, I I spent 20 plus years in consulting. I started in IT, information technology, at Anderson Consulting. And 20 years later, I was a partner at McKinsey. The second dimension to that career was financial services. So I was a part of financial services when trades used to take 5 days to settle. ATMs, you had to go find the network that actually fits your card. And the idea of a credit card and a mortgage were two very, very separate things in a bank, and they treated those customers differently. So
when you were dealing with folks from the McKinsey, from the management consulting angle, I remember at Willis, our old chairman, Dominic Casserly, was a 20, 30-year McKinsey guy. And I remember him getting into the insurance business and kind of thinking, like, what is going on? And he wasn't even on the healthcare expertise. Thinking about it from your old past and how access to the data and really understanding the numbers in every way, shape, or form. Help me think about through that, how is that shaped, or maybe the big aha moment when you got into this side of the business? Draw those correlations for me, because I bet it had to be an eye-opening experience for you.
It is, yeah. It is a very eye-opening experience. If you think about the average leader of a U.S.-based business, they've been around business information systems for 2-3 decades now. People talk about making fact-based decisions. And if you are presenting something to the C-suite, the last thing you're going to go in and start talking anecdotes or 20,000-foot stories. The CEO, more than almost anybody in the organization, needs facts, which requires good information to guide their business. There's too much at stake to just, turn the battleship based on somebody's conjecture or whim.
So, well, this just adds a perfect start point. So I'm on your website right now, and you make a claim here that I want to just have the beginning part of our conversation jump off. And it says, health benefit costs are now more controllable than ever. And, the cynical, 20-year veteran in me wants to be like, Controllable. That's a funny word. Double-digit rate increases for the last 2 or 3 decades. No access to data is what normally people are going to just think is the norm. Let's start there. How are we making healthcare cost controllable?
So one of the things that struck me, so you know that I'm a financial services person. I waded into healthcare as a novice. You know, my best orientation was that of a patient. And as we looked at the healthcare and looked at the information, which is terrible for guiding business decisions, one of the things that we uncovered that just blew my mind was that as price goes up in US healthcare, quality goes down, which conversely, if I would say, how do I make healthcare more affordable? The best way is for each and every person to search for higher quality, and they will have taken one step towards more affordable healthcare.
So John, you know, smart guy, management consulting, right? Like I couldn't go work at McKinsey. I'm not that smart. Was that intuitive to you, or was that even a aha, wow, I didn't realize that? I would have thought, you know, just like I bought my Lamborghini and I spent more money than the Honda Accord, that of course, if I'm, you know, spending more, it has to be the highest quality. Was that intuitive to you, or would you think that most CEOs would know that?
So what I would say is it was so intuitive because I'm a University of Chicago economist type. So I approach the world thinking about supply and demand, and price is the magical thing that clears the market. The irony is that was my intuition. So what was really striking is when we saw the data and we saw basically price going up as quality goes down, that's an inverse. And I went, oh my God, this is backwards. What's wrong with this? And I had people kind of check the numbers, and more, we saw it everywhere that, you know, if you get a higher quality doctor, they're most likely going to charge you a lower price or have, you know, less mistakes. And we all would appreciate less mistakes as patients in the healthcare system.
100%. So, you know, off of that data, right, your entire company is built around data and the use of it. Talk to me about some of the, you could start myths, you could start misconceptions, you could start whichever way, but I am sure that as you got into building a data-centric solution, you started to realize that our industry is anything but using a data-centric approach. So talk to me about, where do we even start with this conversation?
Yeah, there's a couple layers of learning in there. If I roll the clock back about 5 years ago, we were migrating from a wellness product up into small and mid-sized companies. And as we went, quote unquote, up market, they basically told me, forget about benefits. Most of our benefits, they're rounding errors. Focus your attention 100% on healthcare because it's killing us. And for anybody that doesn't know, healthcare costs have been rising at 2 to 3 times the rate of inflation for 20 plus years. So as I talked with executives about that, I basically said, how do you go about making decisions? And the C-suite surprised me in that they said, we don't. And I said, what do you mean? Tell me a little bit more about that. And they said, truth be told, you know, we don't have the skills, we don't have the information, we don't have the capacity to make good decisions about our health plan. So the market tells us what we're supposed to consume. So the big PBM tells me what's best for me on pharmacy. The big medical carrier tells me what's best for me on network. And my broker / advisor, you know, unfortunately, too often is controlled by their own C-suite on what products they must sell. So I was like, that's a problem. So as I said, what kind of information do you have if you were to make your own decisions? And the answer was none. Or things like a wall of numbers. If I get a big report, it's a wall of numbers and I can't interpret it. Or it's 6 months old. Or it has aggregations and it can't let me drill into the detail. So all of those were signs of a bad information system. So Wellnecity basically set out to be decision support for employers to guide them on buying their vendors, managing their vendors, and ultimately helping their people navigate to better healthcare. The second thing that was interesting, and I almost hopped past this, I said there was 2 layers of learning. So I actually pitched our value proposition to a CEO about 4 years ago. It's the fastest sale I ever made. Okay. This guy said, if you can do what you're setting out to do, I can tell you right now, you can don't waste your time on competitive analysis. He said, there's nobody in the market that can do this because I know I've been looking for 10 years and I'm in healthcare. It was a 10-minute sale. Now, the bad part about it was the first time we got data, we could not make any sense out of it. It took us 4 months to clean up the first file we ever received so that it was in a state that was equivalent to what I was used to seeing in banking or trading to guide decisions.
I don't even know where to start on that because I think there's so many correlations to how other CEOs probably feel, right? And so I guess the question I would have on there is, what did you learn from diving into that? Like, were there any, or what was the first aha moment or learnings from that could be helpful for our audience?
Yeah, I think one of the things that we look past is we say information's essential and we say data is essential, but unfortunately we treat it like a ingredient, like cracking an egg, that's easy to go get some data, go get some information, crack the egg and, generate insights. And the reality is the problem is much harder than that. And the way to solve that problem is to actually think of the information as an asset that has to constantly be tended to. And what's interesting is if you take that approach that information is an asset, instead of cracking an egg 10 times for 10 different projects, you actually invest in good information once and you repeat its use 10 times. So the value actually continues to increase the more you use the data. But everybody kind of steps past cleaning it up and making it ready for reuse.
So intuitively, I would think that the average person, and maybe not even the average person, I would think that many advisors as well think, all right, I have this person over here, let's call that person an insurance carrier. They take dollars in, they pay dollars out. They want to probably take as many dollars in and pay as little dollars out. So they have to be full of wonderful data that is going to allow them to make these amazing decisions. Their stock prices are going through the roof. Their CEOs are handsomely paid. Am I wrong in that assumption that like the carriers are the mecca of wonderful information and insight?
So the carriers are the mecca of wonderful information and insights. Unfortunately, they make profits when the employer actually pays more. So right there, they're not incented to give you the information or the insights that they truly hold inside. There's a second part of the problem, which is any information that does come out of the system comes out as a report. And a report and information are not the same things. We always say in our firm that an insight or piece of information without action is just a report. The other thing that I would say is in most other industries, we've gotten rid of static reports that get printed to PDF and passed around. In financial services a decade ago, right, where I grew up, okay? And the reason is reports inherently have the answers to last year's question. The second thing that's a problem with the report is they just grow larger and larger and larger. They accumulate all the questions and all the answers across time. And what we've learned is it's too slow. The best firms need to have information and translate it as fast as they can get it, because that's where they get the competitive advantage. That's why business information systems, decision support systems were actually constructed. They threw away the old reports and they gave frontline decision makers hands-on to the information so they could make in-the-moment decisions on how they wanted to change.
So John, walk me through a real life example, not using healthcare, but pick an industry or whatever, and walk me through their example of this decision support that allows them to run a better business. And then I want you to take that and translate it to either what you're helping people do on the health benefit side, or what you encountered that wasn't happening and why it was taking so long. Like, give me a real life correlation, because I bet people hear that and intuitively they kind of understand it, but like I want to draw the picture that people understand, like, oh, right, this company uses this, and that's how they run their entire business.
Yeah, so we lived through it, okay, and it was called COVID. A major shock. If you think back to March, April, and May of 2020, we shut our supply chains down around the globe in 30 to 60 days.
Yep.
Basically, we said, oh my God, we're in the middle of a pandemic. Demand's going to go to zero. I got to stop production. That is a, good, bad, or ugly, is a very powerful sign of how fast our information allowed our economy, right, businesses to make economic adjustments to their businesses. Okay. On the flip side, if you think about a health plan, right, what's the decision cycle for a health plan? It's 12 months. And by the way, you start talking about strategy three quarters ahead of that, begin date. So it's an incredibly slow process to take information, think about your strategy, make decisions, implement those decisions, and then God help if you want to tune the strategy along the way. If there's anything that changes during that period, you're kind of screwed. Right? If your vendor's not performing, what do you do? If your vendor asks you for a change to strategy, what do you do? Or once again, back to COVID arrives, what do you do? And many of us just watched and waited as COVID happened. Well, our best customers were leaning in immediately saying, who's getting diagnosed? How severe is the diagnosis? How does that translate into my labor force management in all of those locations? And then later, as people were, scrambling for masks and all of that kind of stuff, they were first at the table saying, I need masks here. And they had policies. They were also able to accelerate vaccinations. Now, that's a health plan and how slow it moves and where it could go. Fortunately, there is a silver lining to COVID. I think our health system broadly actually realized that data exchange is really vital if we're going to move as a nation to solve healthcare issues, especially in the face of a pandemic.
So I want to go back to, because I think it's insanely powerful. So you're telling me some of your best clients using data rather than waiting back, and people aren't going to get healthcare. They're locked inside. your best clients were being able to see that diagnosis were happening and actually put down the throttle to make sure that that healthcare wasn't being delayed, in fact, was being achieved. Can you dig into that? Because I just feel that that's a wow statement.
It was really interesting because the first question, we have one client that's in 41 states. They're also in healthcare, so they're hospice and home health, which is a huge issue because if you think about it, you don't want your hospice and home health people going into a client's home sick. So first, it was really important to them to find out how significantly this was going to impact their workforce. Okay. And then second, it became a tactical problem to find out who is sick and who could go where and how to implement procedures and how to implement policies to ensure that they didn't have sick people walking around amongst their clients. Beyond that, we rolled into issues like, well, what is this affect? How is this going to affect this year's health budget, health plan budget? And we basically saw costs come down. We saw the utilizations by site of care come down. And the question that came after that is, when the costs return, is it going to be a wave or are we going to return to average? And we were able to see by the fourth quarter that we were going to return to average and it was unlikely to be a wave. The final question that we had to answer was, well, what visits are being affected? And prevention took a huge hit. So we started talking about people and actually working with travel and logistics to get the most acute issues in for their preventative care and kind of overcoming the market, newsline feed.
This is an amazing conversation because I remember sitting with advisors and employers across the country, call it end of Q3, middle of Q3, 2020 going into 2021. Our book of business, also being self-funded, as you know, was down like 39%, right? People weren't going to get access. Got it, makes sense. And I remember the first round of carriers that submitted to their state, Department of Insurances, financial services, whatever it's called, that they needed to get an increase because we were not sure what the wave is going to be in 21. So in 2020, where people were locked inside for 30, 60, 90 days, 120 days, depending on what state you were in, while we saw what was really happening if you were self-funded and you had your data, the carriers are coming out saying, we don't necessarily know what's going on. We need to pass more of an increase. And they were making it seem as if it was a gift to get a pass, but even clients saw increases. But you're telling me with good data, you were able to see that not only is it not going to be a spike, it's going to go back to normal. And hey, by the way, our budget was positively impacted, if we could say it like that, in a global pandemic. I don't mean to make, not make light of the situation, but the reality of it is a lot of people saw a healthcare gain, if you will. Money is coming in versus money is going out. So talk to me about what things you were looking at in data to be able to help make such an amazing insight, contrary to the biggest organizations in our country were saying to the public as a whole. Meanwhile, by the way, their stock price was going through the roof.
Yeah. So the first one that struck me was some of the larger institutions were coming out with quote unquote projections. And, being a data and data analytics firm, I was like, I wonder what historical data they're using to develop those projections.
Right. We've never been through this before.
What we did in contrast is if you speed up your frequency, instead of relying too heavily on a projection, you can build forecasts and you can capture the new trend line. earlier than a normal actuarial process. So what we did is we basically broke the problem down and we said, what are all the types of care that are being affected? Okay. And we put hypotheses in on each of those care on how they would come back. And basically, as the healthcare came back into the system, we knew that certain kinds of things weren't going to be a wave, right? So if you do an annual visit, you know, when that comes back, you're not going to have 2 visits. So we were able to break it apart and put some pretty reasonable assumptions on how those types of care would return to the system. Now, there's a complete side story to this, which, you know, basically the health system, the health planners, the health plan people got a pass on 2021. Okay. We could see in our population of companies, the company in particular that I'm talking about had a 17% reduction in cost to budget in 2020. Okay, they were flat in 2021, right? So they actually overcame trend, you know, they were flat. Well, we still hear people say, oh, 2021 was up 10%, it was COVID. Or 2021 was down 5%, it was COVID. Everybody just says it was COVID. Nobody actually knows whether they're doing good or bad vis-a-vis trend or the peers. So unfortunately, using the old methods of aggregations, it's created about a 2-year hole in the data with regard to accurately projecting whether you're doing well or not.
So let's personify this, because this is, you know, a real scenario, right? We all just got done and done. I mean, I have an employee out today that just got COVID this weekend. So I don't know that we're done, but we saw this, you know, layoffs.
We lowered the severity. We lowered the severity, right?
So now we're in this situation, but I'd love for you to personify what having the access to really good data and in the way you're giving it, this decision support tool for the audience out there, that's either employers that are saying they're managing their healthcare cost, or advisors who are like, I've been trying to do something better, but you know, I've got this mess to deal with. What does a really good tool really allow you to do? Like, help us picture what it is we're looking at, and what data do we have at our fingertips?
So one of the things that you can imagine a business team wanting to know is, when is the crisis past? Okay. And one of the things that this company was able to see is, as we moved through Omicron, their policies and procedures combined with the speed of the information had conquered the issue, right? The severity was low enough, and their fidelity on being able to see their population and who was getting exposed and how that compared to vaccinations, right? They basically were able to see, I know the percent of my population vaccinated, because it mattered, right? Because they're home health, okay? I know how Omicron affected me geographically, right? And at the intersection of vaccinated and non-vaccinated. And they were able to disband the organization that had managed through the prior 18 months because it was now under control. And that organization, starting in January, February, right? Which, if you think about it, we were still kind of in the middle of Omicron, got back to business on other priorities.
So if we peel back the onion, right, I am seeing in my data vaccination that's running through claims data. The only way you get that is if you're self-insured. So we got to start first there, right? I'm able to see this. I'm able to break that down by geography. I also know through outside stats where Omicron was having issues. They can now piece together what they're doing in those locations from a business standpoint. So revenues, expenses, overall risk of that location, especially when we're talking about hospice. I mean, I've lost both my parents. Both my parents ended their lives in hospice. So I can just imagine the risk management that has to go into that. And then when it comes now to, okay, I've got this data in here, what other pieces are people looking at now to then look into? You said, hey, some people didn't go access healthcare and preventive stuff come down. Talk to me about how you were using, what data were you using and how were you using it to make good decisions?
Well, so the key here is, as I mentioned, a report wouldn't have been that valuable in that setting. So one of the things that we're proud of with our platform is it's designed to support ad hoc analytics very, very quickly.
Wait, John, an ad hoc report is $2,500 every time I want it, and it's going to take 3 weeks if I ask for that from a carrier. You're telling me your platform, what you design, what you expect as the norm is you run an ad hoc report when you need it, and it's just part of the deal.
So absolutely. So two features of our offer for all of our clients, largest to smallest, is all you can drink on ad hoc questions. Literally, it's so easy for us. We've said, bring us your questions. We will answer them.
Give me some examples. Give me some examples of questions that people ask.
What was the severity breakdown for all of my patients that ever contracted COVID?
Okay. So I'm looking at a COVID diagnosis and then now be able to see by patient how bad it was according to cost and services that were rendered. Okay.
We just got a new client that had a 30%, 7% renewal. And, they're like, help. So they're a brand new client for us. And we have sliced and diced their information on root cause and say, how much of this is, high cost claimants, how much of this is concentration of care at providers that have excessive prices, how much of this is, timing, and we basically separated or disaggregated the problem so that management knew cause. And now we're putting strategies. And by the way, this was January 1st. We're sitting here April 5th. We're sitting down with management and saying, here's all the causes that led to that, bad experience last year. And here's the 4 things that we're going to do this year to make that not repeat.
If not using the name of the client, give me an example of those 4 things. So I now have the data. What are some of the strategies you're proactively, proactive strategies you're able to deploy now?
So one of the things is they had implemented a new PBM last year, and they, because of the way things work, they were able to actually disconnect from that PBM.
Let me say it in English. The PBM sucked so bad they fired them.
Yeah, so they're not quite fired. What is happening is they're routing a bunch of things out of the PBM for fulfillment of those meds.
Got it.
Which is something that happens fairly frequently. Not that the big PBMs want to let you know that, but
right.
There's a lot of options on the table today, and we help our clients understand the size of those options rather than the technicalities of those options, so that people are looking at, and a common experience for us as a CEO says, you mean to tell me if I do X with this person, I can knock $500,000 out of my costs? And we're like, yep. And they'll say, let's go do it.
So that's a great way to kind of close this up. I'd love to leave our audience with if we were sitting at a campfire right now and we were having a fireside chat with John Quinn, and we said, what are the most common proactive strategies now people are doing because your system gives them the ability to, with the timeliness, the quality, and the actionableness of data? What are the most common things? How is that impacting people? And financially, how is that impacting? What are the top 3 things that come to mind?
Well, attacking specialty is, a problem area for everybody. And the nice thing is the market solutions are becoming very mature. And the last thing is, if you are working with granular data, you can actually see that making shifts have an isolated impact on people. And then the second thing that you can see is, if you lean in directly with those people, a lot of the solutions actually help them as much as it helps the employer.
And if I'm reading between the lines, leaning into the patient, the actual individual member.
Correct.
Give me an example of that. So doing something good for the patient actually is good for the patient, but also good for the bottom line.
Yeah, so if somebody has a high deductible health plan, which we see a lot, and they are on a med that is, kind of a lifetime prescription, they're paying, $6,000 to $10,000 a year out of their pocket for a drug that they're going to be on for the rest of their life. Saving those households that $6,000 to $10,000 is a big number. And oftentimes fulfilling that med via a different channel can save, 20 to 30% at the net savings level.
I am a person whose father was on Revlimid from the day he got done with a bone marrow transplant to the day he passed away. And my parents filed bankruptcy from that one drug, because how many years in a row does somebody have $6,000-$10,000 extra dollars in the bank, when you're a normal lower middle class working Johnny Lunch Bucket type of person? So completely get it and love it. If you were sitting and
I'm going to give you Lester, I'm going to give you one others that people don't think about or they dismiss. We have a lot of waste in U.S. healthcare is actually what I call mid-office payments and receipts. We are always amazed at, the amount of money that is uncovered because we see fees that are being billed in error, or rebates that are going uncollected, or credits that are going uncollected. And that's all free money to the employer. So that would be a second category outside the specialty farm. I just wanted to throw that in as something that, oftentimes pays for the whole information platform without any impact to plan or members.
So John, in that example, you are saying nothing more than your plan says this, your contractual arrangement with service provider A says that this is the financial arrangement between the two. And what you're saying is, on the back end, using your platform, you're now able to see, did they fulfill their obligation? That is a contractual arrangement with the two. Because P.S., no one's going to raise their hand and be like, I didn't meet my obligation, I should probably pay you back, right? So that kind of makes sense. So that's being caught. So intuitively, somebody would say, well, wait a second, how is the TPA, the insurance carrier, the PBM, how is nobody catching this? Aren't there checks and balances, across the system? How do you respond to that?
Well, I think it's accepted that, healthcare and health plans are very complex. And it's actually just hard to watch all the moving pieces.
Right.
That's before we talk about incentives. The TPA doesn't get paid to get that incremental catch. they get a flat fee. So that's the problem, is the system is flat fee kind of orientation instead of, pay for performance. Two that I love, we had a client that was a sizable client, 10,000 lives, 5,000 employees. And they negotiated with Blue Cross Blue Shield around their ASO fees, their administrative fees.
Yep.
They spent 6 months negotiating with Blue Cross Blue Shield and actually went into the year before they got the contract, inked. So they got the inked, everybody celebrated. And a month later, one of our analysts comes up and says, they never put the new contract rates in. So we had to chase down, inside of Big Blue, who's in charge of changing these. It took us 4 months to actually get everything turned on and at the new contract rates. In fact, the funny part is we finally got the change negotiated. And they said, we're good, right? And the analyst was like, well, what about the first 6 months? The contract says that it's retroactive. And that was another 2-month argument to get that, fixed. So those kinds of things happen all the time. By the way, that number was, I think it was about 280,000.
Yeah. I mean, we talk about $60,000 employee, that's 4 to 5 employees. That's, a new fire truck. If we're talking about a city, that's a couple pennies maybe on an earnings per share, depending on the size of the company. I mean, we're talking about real dollars. So I want to leave everybody with maybe like John's words of wisdom, right? So I think, having been in this business my entire life, it is complex. It's hard. You're relying on a lot of other people to do their job. And quite honestly, a lot of other people that have a lot of misaligned incentives at times, whether it's the broker and advisor who makes more money when the client pays more, whether it's Blue Cross that calls your client's premium their revenue, whether it's the hospital that gets paid more if that surgery isn't necessarily quality and you have to get readmitted, right? I mean, the reality of it is the system isn't broken. The system's designed exactly the way it was intended to. It's just not benefiting anybody who's probably listening to this call from an employer seat, and it's surely not benefiting the patient. So if you were going to leave, let's go both audiences. Let's talk to the employer. There's employers out there. Healthcare costs are their second or third largest expense. It is one of the main reasons people stay or come working with them. We're in the middle of the Great Resignation and all these other fancy terms that they're calling right now that people just are not wanting to work and going and job hunting. Like, what would you tell that employer out there who for years has been told this is not a controllable expense, has been told you can't really do anything about it? They might be working with the brand name insurance advisor and the brand name insurance company, and nobody ever got fired for hiring IBM. What would you tell that employer?
Yeah, that's very simple. I mean, I'm going to give a few truisms out there that are just wisdom for any business person. One is, people always say, if you ever want to fix a problem, the first thing you need to do is own it. And I think too many employers have just kind of turned ownership of healthcare and health expense over to the market. The second thing that I would say is too many organizations think they're too small. And that's the reason why they're getting bad prices. And what I have found is that there's actually suppliers that are very efficient out there that are willing to give even the smallest employer their best price. So don't presume that you have to pay a premium just because you're small. And then I have to go back to our value proposition, which is, if you're going to own a problem and you're going to shop for better prices, and you're going to manage your vendors to higher accountability, you probably want your own information that you can trust to guide your decisions.
Man, I love the first one. I wrote it down. If the only way to fix the problem is to own it. I just absolutely, one of our value words as a business is called accountability. And like, it's just a perfect scenario there. All right, so switch gears. Every employer, for the most part, has somebody advising them. They think that this person is, doing what's in their best interest. They get all of their information from that. And they also have 15 Tom, Dicks, and Harrys calling them on the phone, selling them every shiny new toy and buzzword that's on there. What do you tell the advisor, having, again, sat in front of employers, understanding what they need, seeing the data, understanding what they need, and being in the best seats in the house at McKinsey? I mean, you were at the biggest of the biggest with people making gazillion-dollar decisions. What do you tell an advisor out there?
Yeah, so this is where having the information can really get fun. The first thing I would share with advisors is the new solutions, those things that aren't the status quo, are working. Now, that may be too much for them to trust, which means they need to try. And what we encourage advisors to do is, rather than taking their client through a purchase process, have these new solutions pilot, right? So we took a lesson from the technology industry, which says, don't do an RFP, do a bake-off, and then implement somebody with a multi-year contract. Give them the data, size the value proposition vis-a-vis their solution, ask them for guarantees, have them do a pilot, measure the pilot, and then let them go if it works. So we call it, trial and then scale, rather than buy and then hope.
I love it. Well, man, John, this has been fantastic. I think we're gonna let's schedule a replay of this, and I think that we show a demo of it, or maybe we could do one and put it in the show notes that people could actually see, like, hey, instead of the fancy 18-inch binder that your carrier prints you off every quarter and sends their medical director down to have a conversation, this is really what you need. So if somebody wanted to learn more about Wellnecity, where do they go? How do they get a hold of you? How can we continue this dialogue for people that are intrigued right now?
Yeah, I would say a couple things. Our website is wellnecity.com. That's WELLNECITY.com. Or they can call me, 704-898-3191. I love what we're doing, and I'm happy to talk with any potential client, employer, advisor. I think we're all in the business. One of the reasons that I've enjoyed getting to know you, Lester, is we have a term for advisors and brokers out there that are helping break the mold, and we call them the Rebel Alliance. And we really appreciate getting to know folks that are seeking better outcomes, higher quality, lower price, more affordable healthcare.
As somebody who's grown up seeing two parents battle cancer and file bankruptcy and all of that, and this is all I've ever done. I mean, I can't think of a better thing, right? It's 18, 19, 20% of our GDP as a country. We spend 10 times more than any other developed country for not even that great quality. I mean, there's all sorts of things that says everybody that's in the business. So my battle cry for our advisor audience was like, is this what we got?
Yeah.
I always say, if you took the trend lines of all the clients and inverted it the other way and said, would you allow your personal financial advisor to lose you money on your personal portfolio and keep hiring them? But that's exactly what we keep doing year after year after year after year in the healthcare business, and it's just time to change. So, John, thank you so much for giving us these words of wisdom. I love the truism that we ended with. So for my audience, make sure you go check out Wellnecity's website. We're going to try to post something down in the show notes so you can see the platform. You will be blown away with the data and the insights and the decision support, the actionableness that you need in order to be proactive. And I just appreciate John for joining us. For the full episode, or if you want to go catch any of the other episodes, impacthealthcare.fm, and be part of our text community so you can get a text message every single time a new episode drops. That is area code 813-537-6992. John, thanks so much for being a guest on Impact Healthcare. Impact Healthcare crowd, we'll see you on the next episode of Changing Lives with Impacting Healthcare. Thanks so much, guys.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Visit impacthealthcare.fm/journey to access leading industry case studies, compelling member stories, and to check out all of our podcast episodes. That's impacthealthcare.fm/journey. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.